In your professional experience, what have you seen as some of the main benefits of integrating a mind-body approach into mental health services?
Well, essentially, I think it's pretty mandatory to incorporate a mind-body awareness. With my practice and what I write about, I developed something that incorporates an attention to body, mind, feelings, and behavior. And it's called the STOP solution. Some of you might be familiar with it. It's an acronym. It means that first you scan and catch a thought, an emotion, a cognition, and then as soon as you catch the seed of it, you seed of an overreaction, then you take a time out. The STOP solution is an acronym. S is for scanning or catching. T is for timeout. I very much believe you need a few minutes to down-regulate the body, so you take a timeout, and then in the timeout, you overcome the reactivity, overcome the flooding, and then P, that's when you can put tools into practice that you learn, that you teach, that you can have perspective. Now, essentially, the body is a file cabinet for the mind. One of the people I studied some years ago is the late Candace Pert. And Candace Pert pointed out that we are not body and mind. We are body, mind. We are one. There's a feedback loop. We know that. And by listening to the body, as well as the thoughts, we can heed early warnings of reactions. Now, one of the things that has been true in psychotherapy, just even since I've been a psychologist, which I started in my 20s, so I've been through a lot of the different popular paradigms, is for many years it's been a cognitive approach. Essentially, that's a top-down approach. And now we're discovering some of the neuroscientists like Dan Siegel and Diana Fosha and Marion Solomon, a whole bunch of people are doing bottom-up therapy. But basically, I believe you need to do it all because it is just reductionistic to think that the mind is a puppet master for the cognitive processes. It's not enough. So I'm passionate about the fact that we have to have a comprehensive approach that integrates cognition, body, mindfulness, and that you get to be familiar with all those approaches. And if I have a minute or two more, can I go on?
You do, Carolyn.
My colleague in California at Stanford, David Spiegel, did an interesting study some years ago that really provided some efficacy for hypnosis, and you may have read about that study. It got a lot of reviews on TV and New York Times, etc. And he worked with 86 metastatic breast cancer patients, and these women, had stage 4 cancer. People with stage 4 cancer often don't live, particularly then. And what he did is he put them in a group, and he taught them self-hypnosis. Now, the publicity about the media focused on the importance of the interaction, the connectedness. They don't emphasize that he also taught them self-hypnosis as well. And I believe both were very, very important factors. And these women lived twice as long as the control group in 10 years. Quite striking. And so it is clear, we're getting more and more evidence that we need to address everything. Now, some of us are more connected to our cognitions. We'll catch a thought. I'm more connected to my cognitions. I can't believe this is happening quicker than my body. Some people catch it in their body. Some people catch it in the feeling of being on edge or irritable. But we need to catch it and then talk back to the brain, of course. Now, I have a quote that I will share. It's not original at all. It's not original from him. I got it from Deepak Chopra, and this is from an Indian sage who wrote, "As is the microcosm, so is the macrocosm. As is the atom, so is the universe. As is the human body, so is the cosmic body. And as is the human mind, so is the cosmic mind. And thank you.
Thank you, Karen. Would anyone on the panel like to share their points of view on that question? And I'll repeat it. In your professional experience, what have you seen as some of the main benefits of integrating a mind-body approach into mental health services? So at this time, anyone else on the panel want to add to Carolyn's insight?
Hi. So I'm a clinical health psychologist, which means that I work with people primarily who have physical health problems. And often when I was working in a hospital, it's for a couple of reasons. Usually they're non-compliant with whatever the physical protocol is supposed to be, or they have some other trauma, makes them complicated, no one knows how to work with them. Sometimes it's direct, because there's a direct depression or trauma issue that needs to be addressed psychologically. But it's all integrated. So it's very difficult for me to actually interact with someone without understanding what's happening physically. I'm not a physician, but I've been around enough. And so if we have one nervous system, if part of it is just irritated in some way, it's going to impact your thoughts and your emotions and how you engage with other people. And so it doesn't matter really where we interfere with that loop. We just need to interfere with that loop. And some people are going to respond in different ways based on their makeup, or and if we listen for that, it's like, oh, okay, so music is something that allows you to be really present. Maybe that is the mode of entry here. So I think we have to think about things in terms of where is that place where we can interfere with the pattern. And it might come from somewhere up here or somewhere down here, or sometimes, someone, if we're able to be present enough and we pick up in the session, what was that like tension that I just saw right there? What was that about? Can we just stay there for a minute and just, what is that saying to you? We get the richest material. We get the stuff that really matters. And so I don't see how it's possible to really disentangle them. And I think once you, my training was, I was all like cognitive, super cognitive. And the biggest lesson I had was watching a supervisor of mine who was trained in California and did this chiming thing in the morning. And he would just sit with somebody and just pick up on their energy and comment on it. And we got right to the point. Forget the agenda, forget the homework. It was really about bringing themselves into a place of presence and picking up on whatever they picked up on and then got to work. So mind, body, spirit, I just don't know how it's possible to do it any other way.
Right. Yeah, I think Carolyn wanted to add to that. Thank you.
I wanted to piggyback on your very well-articulated thoughts about it. Thank you, Stacy. The other thing that is kind of implied is that we need to be connected to our own energy to have that attunement to connect with what's going on with somebody else.
Yeah.
I can add
Please.
a couple of things. So my area of clinical focus is a condition called Tourette Syndrome. Some of you may have heard about, and people with Tourette Syndrome, they have tics. They're essentially involuntary movements or sounds that can be mild to moderate, or they can be severe that they impact function, cause pain, and such. And so, to what extent you intervene with the tics is partly dependent on how problematic they are. If they're mild, it's not, you generally recommend ignoring them. However, what's interesting is what people's subjective experiences of their tics. Yesterday, I saw a 17-year-old boy who came in to see me because of a severe tic he's having. And I was emailed a few weeks ago by his father, who found my name, and desperate. And usually when these desperate emails come in, or phone calls, often there's a lot going on beyond the complaint that the person's raising. What was interesting is the boy yesterday, I saw him first, his mother sitting outside, and he tells me, I just want to focus on my Tourette's, meaning his tic. And I thought, isn't that interesting that he doesn't want to go to the other potential areas that are relevant? And of course, later his mother comes in, and there's a lot of chaos in his life. So, and to just focus on the tic itself, you're essentially shortchanging yourself, you're shortchanging the client or patient. And when a patient comes in with, some patients come in with what look like pretty dramatic, striking tics, but they say, I'm fine with them. Their parents may be bothered by it, but they're okay with it. They have a good social, they have good supports at school and whatnot. And then on the other hand, you have some people that come in with what look like quite mild tics, but it's the end of the world. Like, so it's so awful. And so if you just go focus on the tics, because we're gonna work to eliminate your tics completely. I think you're fooling yourself rather than looking more broadly, holistically in terms of what's going on with the person. And that, I'm using the tics as an example, but that applies, I would say, to so many things. When we focus on symptoms, as unfortunately, my profession often does. When I see the other, I see a lot of adolescents who are in crisis, who are suicidal, and sometimes I'm not characterizing here. I'm almost literally this interaction. An adolescent in the emergency room, they're suicidal. I ask them, so why do you want to kill yourself? Because I'm depressed. I've got depression. Okay, so what are you so depressed about? Why are you so sad? I don't know. It's a chemical imbalance in my brain. So there's so if the focus stays on that, we're going to treat your depression. We're going to adjust, the chemicals in your brain and whatnot. You're completely missing out on what's going on in this person's life.
Thank you, doctor.
Do we still have time?
Sure. A minute. Yes, go ahead.
I just wanted to say that I think it's a dishonor to our clients to compartmentalize all the different things that are happening in their lives. And I think when we're thinking of just what's happening here and above, we're missing everything else that's happening. So I think that it's important to, and I think a few of my colleagues touch on it, is to pay attention, to just be present and be mindful of what's happening with your client. Thank you.
Yeah, absolutely. Thank you, everyone on the panel. We'll move on to question 2. If you could pass that over to Karen, that would be great. Hey, Karen. A big focus for this conference is the role of the unconscious in mind-body healing. Can you speak to this, specifically what this means to you?
Okay, so the role of the unconscious in the healing work we do, I was thinking about that during Dr. Mate's keynote. And of course, as he always does, he gave us so many golden nuggets. So I wrote down a few of them. These are like tweetables. So he said, I've never heard this before. The traumatized processing apparatus. Was that new for anyone to think about? This is the way the traumatized processing apparatus works. And I thought that was just a profound way to describe how our automatic, habituated cognitive and behavioral patterns show up in an instant. And we think it's because he said that. But it's really because of this traumatized processing apparatus. And so much of it, probably all of it, is unconscious, at least in the moment when we're triggered. It's unconscious. And I liked how he talked about healthy anger versus rage. And I was thinking about, myself in traffic, first of all, and then, clients with anger management issues and so on. And it seems to me that the difference between anger and rage is that healthy anger is just that, an expression of a need for boundaries. And it's just an expression of a need for boundaries. That's all it is. It's just an expression, and it's healthy anger. And when it's rage, it's an expression of repressed emotion. It's always an expression of repressed emotion. So I think we all need to be more comfortable talking about the unconscious, talking about the integration between, like what Carolyn was saying, we can do the really good top-down processing, and we should do that, because I know that I've heard Carolyn say we need good tools to offer our clients. And we also need to pay attention to the bottom-up processing, to the way the unconscious speaks to us, of how it is ready to heal us whenever we're ready to call on it. It can speak to us through our body. It can speak to us whenever we take a moment to go inward and to stop all that thinking stuff. And so it's about that dropping down that we all help clients do. And when we're helping clients to drop down, then what are we doing? Then we're helping our clients to unlearn, to step into what Dr. Mate talked about, our authentic selves, by work with the unconscious, whether it's trance work or whether it's body-oriented psychotherapy work or some of the spiritual healing. If that's a left-out piece of the puzzle, then we're only tapping the surface. So that's why I think, it's important, right?
Thank you,
Yeah,
Karen.
you agree?
Well, I absolutely agree, but something that you just referred to made me think about myself in terms of being a woman and being just learning unconsciously that I shouldn't show anger, that I could be sweet and nice and helpful. But even now, I'm getting old enough to be able to embrace all emotions, but I'm still, anger is it's a lost emotion for me that goes way back.
Wow.
Yeah, because of the culture that I grew up in terms of nice girls do not express anger.
Oh, yeah. And it's still prevalent.
Yeah, and still prevalent. I have a women's group, and it's still an issue for women in their 30s who are in my group. Yeah.
Thank you, Carolyn, for saying that, because that's exactly what I was just thinking. Well, the piece that I was thinking about is how much gender really does play a role in it. Because, I mean, as women, we're conditioned to, or at least not even conditioned, but we're taught at least to feel every emotion in the book except anger. Right. But yet on the other side of that, men are often taught not to experience everything but anger. So it's so fascinating to me. And I think about the message about anger is a healthy emotion. It's just a matter of how you're expressing that anger gets lost in that message.
When I hear unconscious, I think of just lack of consciousness. And I think about how many of us, when we go through that transition and we really understand at a deep level what it is to trust, and really become committed to being ourselves and have that ultimate respect, not just for ourselves, but for others, that process of becoming conscious is painful, it's scary, but when you get there, you realize that much of what we're dealing with is a lot of unconsciousness around us. And it allows me anyway to get into a place of compassion and be able to see that for what it is people living on the outside as opposed from the inside out. And so, as I work with people and they become conscious and they kind of get disoriented, they can't hang out with the same people in the same way. I see lots of heads nodding, and they're in this kind of middle zone and they're not really sure. And so because I've done that work and I understand it, it allows me to kind of view what's happening in the world around me in a different way. That there's a lot of people who are walking, acting, being very unconscious. And so I'm so thankful when I see this room of all these people who are so dedicated for themselves and for others in terms of coming into a place and understanding that this world changes from the inside out.
Thank you for that. Dr. Abby. We're
I
going to go
won't
to you
add
next
that.
on the next question, Doctor. Yeah. Thank you for your response, everyone. And again, I should remind you, the audience will be invited to share their points of view when we get through a few more questions. So, Doctor, do you see any risks in offering complementary and holistic care to conventional mental health services? And are there any Are there any special considerations to be undertaken with respect to scope of practice and other ethical standards?
Yes, thank you. I think there are so many ways to answer this question. There's so many aspects to it. I think the biggest challenge, so first of all, just to get it out of the way, there are some practical challenges related to, in terms of the scope of practice issue, is a lot of us, depending on what specific professions we belong to, have regulatory bodies, and these regulatory bodies are observing, monitoring to make sure nothing untoward is happening to the patients or clients we work with. The fact is, things that are untoward happen all the time. But if it happens while you're doing something that is outside of what's standard practice, what would be considered, at least in my field in medicine, what would be called the standard of care, you might be doing the standard of care and something bad happens. It just happens. But if you're practicing outside of the standard of care and something bad happens, you're going to be scrutinized, and you better be prepared for that. So that is a big challenge, and that is something to be aware of. But I find the biggest challenge isn't even that. I find the biggest challenge is the context, really. It's the socio-cultural context that we are in, whether it's the context of the patients or clients we work with, or the colleagues we work with. I'm often reading notes from colleagues who have admitted a patient, and the patient comes in, they're suicidal, and so this is just to give a bit of context. Part of what I do is I work on an inpatient unit at Sick Kids. And so suicidal adolescents is like bread and butter for us, unfortunately. And so they come and so you're reading the note, and the first thing it goes to is has been feeling depression since that date, and these are the symptoms and whatnot. And giving the social context, the psychosocial context of what this kid is going through, at best comes as an afterthought at the end, and it's so medicalized. And I invariably get very angry when I'm a guy. I do express anger, so I get angry reading these notes, and I find it very frustrating. But then it's not just the colleagues. It's not the adolescents themselves have fully drank this Kool-Aid, and they come. I gave you guys the example earlier of the kid in ER, which is a not uncommon, pretty common example. So. They're talking about, I have depression and I have a chemical imbalance, and to critique that is not easy, without coming across as invalidating, right? So I don't critique it. I let it be. I don't say you don't have depression. They are struggling. They're suffering big time, and this is the lingo that's used in this culture, right? In a maybe in a different Eastern culture, we'd be talking about energies. Here we talk about serotonin. And, interesting, by the way, I was looking through the program, tomorrow's morning session, in the description, in the same phrase, it says, in the second paragraph, I think it was so striking, it says, after the musical chakra and serotonin boost. Like, wow. Talk about, marrying these different concepts. But anyhow, it's the point is, this is the language we use. And there's a difference, though. I think to be a bit critical about it, that I think sometimes the language, let's say the language of energy or other concepts in Eastern, these have come about through centuries and millennia that have been passed on. There's a very long history and social context to this. The language we use here is not always the case. Sometimes it's a very deliberately manufactured, marketed concept that we buy into. Nevertheless, this is the culture we work with, and this is what we want to be aware of. So, and we're not going to. The aim is not necessarily to entirely change that culture, but how can one work within that culture? And I think if Dr. Mate was here, I'm sorry, I may be going a bit long, but I'll finish up in a minute or two.
Please.
if he were here, again, a guy thing, right? You thank to Dominic. Whereas Dr. Deitch asked, can I have a minute or two? And I just said, I'll take. If he were here, he's tried to explore my anger and where that's coming from. Is that the first time in your life? And so I think, but his point, which I thought was such a powerful message, is you have to bring in your person as a person, right? And when I talk with trainees, I say, you cannot, whatever little world that you're working on, your own sacred space that you're creating with the client that you're in, that's what you focus on. And doesn't have to be that every encounter is a big critique of the dominant paradigm of today, and that's why. So you bring in yourself, you're present, you're authentic. I think that's how. And it's with the clients, and I would say with the colleagues as well, because I think everyone is well-meaning. Everyone or almost everyone is trying really their best. And have the best intentions, even if you're not quite on the same page. And there's a way to somehow find common ground and work together for the sake of the client. So that's my thoughts.
Yeah, yes, please. If we could continue with the panel responding to that question. You do have another minute or two.
Yeah,
everyone.
I just
Thank
wanted
you
to
for
add on to one thing that you said briefly, that you're obviously so sensitive to your patients. I see a lot of people with GI distress, particularly irritable bowel. And there's definitely a link between anxiety and the gut. There's no doubt, and I get some very wonderful gastroenterologists in my area who recognize that, but they also don't know what to do. But sometimes to address to what you're saying, not what I'm saying, to address to what you just said, is that people get really upset if they're invalidated by their physician. If a physician doesn't understand the etiology, and you don't always understand, they'll just say, well, it's all in your head. I have a psychologist or psychiatrist you can go to. And they get feel so dismissed by that. So I'm glad you said that parenthetically, that you can't do that. If somebody says they have a chemical imbalance, I think you need to say, you probably do. And there's a lot of things we can do with that, rather than to not join with where they are. So I think your patients are lucky to have you.
Yeah.
Thank you. I think just quickly too, it's the problem with the issue of the chemical imbalance. Never mind. It's so, to be honest, it's so. The chemical changes are happening in our brains all the time. Just now, from me talking and you responding and you listening, and so so the concern is that it can become disempowering, right? It's something else that I have. It's this condition I have, and so I just say, our chemicals in our brain are changing all the time, kind of thing, and they are part of us. We can influence them, and so just to bring in their responsibility. I like that tweet from Dr. Mate this morning. So, yeah.
Anyone else? You're okay. Okay, let's move on. No, we'll move on to the next question, Dr. Thomas.
Okay.
Thank you once again, everyone, for sharing your insight to these questions. What advising do you have for therapy professionals who are wanting to incorporate mind, body, spirit interventions into the care they provide?
Okay, well, I think that this kind of dovetails on what has been discussed already. As I've already shared, I've had my own journey with my own spirituality, which came from actually walking the walk. So for, close to 15 years, the earlier part of my career, I teach mindfulness, I teach deep breathing and all of these tools, and they were great tools because it helped me be effective very quickly with people. And I dabbled in meditation myself, but I wasn't really practicing it for myself, to be honest. And, I actually was talking to Dr. Deitch because it was 2 years ago when I call it the summer of chaos, where it was all those shootings, and Dr. Deitch just happened to be in Toronto, and I was at her conference, and I actually met Karen Day at that time, and you too. And I was experiencing my own turmoil, and Dr. Deitch, it was the first time I actually learned how to put myself in trance. And the insights that came to me at that time were very powerful. Some of them I still share today in terms of poetry that came out or images of myself, and a clear understanding that I am a spiritual being first, having a human experience. That's the insight that I think really summarizes what Dr. Mate was saying, what a lot of us are saying. Because when we understand that, oh, if we think of ourselves as just human, that's the material realm that we're in. We're inherently flawed. That's what that tells us. As opposed to, I'm a spiritual being that is integral and whole. Right? And so people, I have a scientific background. People will say, well, how can you prove that? Well, how can you prove any theory? The proof of a theory is whether or not it's useful. We can't really actually prove a theory. It's what does it lead to? And so I ask you, if you put those two theories of being beside each other, one leads to a lot of looking to the outside. It's a very useful theory for consumerism, for oppression, for a message that only certain people get to be up there, and they have these big castles, and they got there by oppressing and killing and doing a lot of nasty stuff. But we praise them and give them all our money and think somehow we should be like them. As opposed to having that deep respect just for yourself as well as someone else. So in terms of my practice, when I'm meeting with someone, I mean, I know all of you have spoken to people that have had horrendous upbringings, and yet when you ask them, what did you need then? They can tell you very clearly. From a small child, they know. So isn't that amazing? Like, you didn't know anything else, but you knew what you needed, and it wasn't there. And then you had to adapt to survive in this place. And so if we have that deep respect, if we see ourselves as being a whole intrinsic being, then we actually get to rely on our training and background to kick in when we need it. We can be very present with people and understand and see their resiliency, understand and see their wisdom, and highlight that for themselves, amplify that voice. And we get to join in that experience, and we benefit from all of that, that wisdom that comes our way. That's one of the positive side effects of our jobs, right? It also allows us to stay in that place where we're taking care of ourselves as we're taking care of others. And so what I would say is that it's kind of tied together, this practice, that it becomes integral to how you live. I'm always surprised that I can't say I'm someone who studies Buddhism, but every once in a while someone will share something with me. I'm like, oh, I wrote that down. That somehow came to me. That wasn't me. And I get that. And I can have conversations with people, because when people are in that in-between, there's no one else they can talk to about that. And things mobilize very quickly. Okay, so I guess my advice would be is that finding whatever that practice is, to find that and dedicate yourself to that, and it will ground you in your practice. But also to start thinking about the implications of that difference. And what I've said when I've met with people of different cultures, thinking yourself as a spiritual being is more aligned with mindfulness. It's more aligned with a lot of our cultures in the world that are more based in nature, as opposed to a more materialistic society like ours, which disentangles and takes that away. And so when we're working in a Western society, understand that I will say quite plainly to people, these are my assumptions coming in. This is how I see you. And if that doesn't fit, that's okay. We can still do some work together. Maybe you come into that way of being, but I need to be honest with you at the beginning as where my assumptive place is, so that we have some clarity. Because I could label you, like if an insurance company asks, I can do that. I've done that all day long with my eyes closed. I can figure out what boxes to check, but that doesn't encapsulate you at all. And so we start listening to anxiety, we start listening to depression, we start listening to the message of what the body is saying. We work in a different way with the assumption that this person knows some things. So that's I guess my advice is to look at your assumptions, challenge that, and try it on. Do that thought experiment of, if I do adopt this way of seeing myself and seeing others, what difference does it make with my practice and how I am in the world?
Excellent. Thank you for that. Yeah, and I like where you're going with that. A very transformative experience for the mental health practitioner, being transformed and then bringing that grounding into their practice, and in turn transforming others with the mind-body-spirit connections. And I know everyone in this room are firm believers of the mind-body-spirit connections. That's why we're all here talking at this conference, learning together. And I'm looking forward to hearing your points of view also in a few minutes, everyone. So thank you for answering that question, Doctor. We'll now move on to the last question. And Jamie, how best can we create sacred and contemplative spaces in clinical counseling practices? How can we honor not just the cognitive, emotional, and behavioral aspects of healing, but the psycho-spiritual journey of each client as well?
Okay, thank you.
You're welcome.
First, I just want to say thank you to Karen and the Daybreak folks for inviting me to be here. This is actually my first panel, so I'm so honored to be part of this extensive experience from my colleagues on this panel. So thank you. Thank you. So I guess just to be able to, before I answer that, I want to tell you where I'm coming from to the true core of who I am, not just as a practitioner, but as an Indigenous woman as well. And I find working within an institution, because I work in a post-secondary institution, which of course we all know is historically a very colonial place, often we have to think of things from different lenses. And when working with my clients, I find I'm always trying to have various lenses. I'm looking at them from different points of view. And I think that really, even though that's really the essence of why we're here, is that we're appreciating the experiences of our clients as a whole. As an Indigenous person, there's a teaching about that, and it's called the two-eyed seeing. And essentially what it means is that it's allowing us to be able to look at the strengths from an Indigenous point of view as well as the strengths from a Western point of view. And I think why that's so important is because it allows all of us to be able to benefit regardless of what lens you're looking at. There's still that appreciation for those different point of view. So when we're looking at what does a sacred space mean from those lenses, with a westernized lens, we're thinking about it in terms of our clinical practice. We're thinking about how we maintain confidentiality, our ethical obligations to our clients, how we're taking care of ourselves, and how we're ensuring that we're using evidence-based practices to be able to work with our clients and implement those techniques. And even just the way we're building rapport with clients. But from an Indigenous point of view, we're looking at that in more of a holistic way of looking at things. And I'm talking about the physical, emotional, mental, and spiritual aspects of that client. And I think why that's so important is because it really speaks to not only how everything is interconnected, not just with ourselves, but with our communities, our families, and even all beings. By being able to provide a sacred space, we're trying to find the balance with all of that. So I guess just going back to that, and again, this is assuming if our clients are there, spirituality essentially is an essential piece that unfortunately is overlooked within the Western institutions. But we need to walk beside them with where our clients at. And if that's where our clients need to go, that's where they need to go. And our job is to walk right beside them. Unfortunately, especially with Indigenous peoples, because our people have literally had the spirituality beaten out of them, or even shamed out of it. So we need to be able to draw strength from that spirituality through our connections with the Creator, with the land, and with all of our relations, all of those beings that exist in this universe. Because when it comes down to it, we're all forces in this universe. We're all connected. And So really to go back to, just to kind of, I always like to circle it around to where I'm coming from is when we're looking at it with multiple lenses and really with a two-eyed seeing, we have to be able to appreciate that wholeness. So I guess what I'm trying to offer to that answer is just a different perspective on what it means to be a holistic practitioner. Thank you.
Thank you. Would anyone on the panel want to respond to that or add in? No? Okay. Thank you. Oh, go ahead. Yeah.
I have a question. In a way, it's a trivial question, but I think it'll be helpful for me personally. So I'd be interested in thoughts from people on the panel, but also from the audiences. Can we define what sacred means?
Yeah, go ahead. I'm going to see if I can get this microphone. Do you mind? Or I can try to.
I can get up.
Great.
No, there is a protocol.
That's okay. Thank you.
I think if we're to, from my perspective, make it encapsulated in something simple, because it's a very broad subject, I would say it's alignment. Alignment. You know, whether that's alignment of the body, or alignment of an actual experience of connection. But I feel if we're not aligned, we don't actually experience our sacredness. So to me, it's alignment.
Yeah. Would you like to add to that, Karen?
Yeah, I love alignment. I love that word. And I'm going to, we should get the audience in on this too.
Yeah.
The thing that just came to mind, and I want to continue to reflect on it because this is like a groovy discussion, is that I think something is sacred when there's a personal journey of meaning involved. And for me, when when the word sacred resonates with me, I think of any time I'm willing, no matter what pain, anytime I'm willing to transcend every story and every narrative that has ever been given to me, and trusting that which cannot be named, that has no definition, but boy, is it ever smart, and is it ever beautiful, and I see it in all of you, and I feel wonderful that I can't define it, but boy, do I ever know when it's present. But it has something to do with unlearning and my own personal journey, and it's not yours, so it's not yours to claim. It's mine. And I love listening to Joseph Campbell, and I love how he describes the hero's journey, which is that journey of unlearning. And not every one of us wants to take that hero's journey of just smashing down and unlearning everything we've ever been taught. And then, right? And then we use what we've been taught. But what I find myself saying to clients and students a lot is energy first, solution second. And I think that, for me, is sacred. But I'm still thinking about it, so I love the discussion.
Go ahead, Sarah.
So I was, can you hear me? I was like bouncing in my seat. I want to answer.
Yeah.
So for me, so I'm a Mohawk from Tyendinaga territory. And so for me, when I think about sacred, especially in terms of sacred space, I feel like it's very individual. It's really about me and my space, and it's about you and your space. And so for me to be able to hold a sacred space or to create a sacred space, it really is about the energy that I carry, that really, I think everything is just about energy. So if I'm going to have somebody come into my safe space, I have to be able to hold myself in a way that is my authentic self. And my authentic self has to be open and understanding to their authentic self. And even if their authentic self isn't at their authentic self, it's where they are at that moment. And that is their authenticity in that moment, even though they're not where they want to be or where where creation is expecting them to be at some point in their life. It's really about just being open and gentle to being whoever we are and accepting people. Like Dr. Gabon-Raté said earlier, it's about wherever people are coming from, we need to just be okay with that, because it's not always about getting people to an end result, but just being there and supporting them in whatever they're experiencing. So for me, sacredness really starts with me, or starts with you as an individual. It's something that only we can design and develop and implement, and it's going to look different for every single person, because we all have our own sense of sacredness, and it's going to depend on where we're coming from in our lives. So thank you.
Thank you. Would someone like to add to her comments before we move on to the next person?
To the lady that just spoke, I just want to say miigwech nyawa for sharing that, because I was thinking about safety as I was listening, the importance of safety when as a definition of a sacred space, but you so beautifully articulated that much better than I ever could, so thank you for that.
Yes, Carol?
Well, first of all, it's a challenging question, and I appreciate it. And I haven't thought about it a lot. But in my training in Imago therapy, I don't know if any of you are familiar with Imago relationship therapy, but they talk about the sacred space being that space between you and me at any given moment. And when I started to think about it, and again, excuse me for having not thought about it, so it's off the cuff here, but it's like that the sacred is in the space between you and me, Karen, and that connection, and the space within me and me. And then this, if you're a believer in the connection to something greater than myself. So it's about relationship for me, and listening to the truth of your truth juxtaposed with my truth, and juxtaposed with that intuitive psychic truth that just pops up and we have to listen to. Does that make any sense for something that I haven't thought about too much? Okay.
Thank you, Carol. Yes, another.
Yes,
interaction.
I think of prayers, and there are many languages for prayers, many languages, and I think of an ancient prayer that speaks to me, and it may require some translation of words like God or whatever, but I would just like to speak this prayer, which to me embodies the sacredest, Saint Teresa of Avila. May today there be peace within. May you not forget the infinite possibilities that are born of faith. May you use those gifts that you have received and pass on the love that has been given to you. May you be content knowing that you are a child of God. Let this presence settle into your bones and allow your soul the freedom to sing, dance, praise, and love. It is there for each and every one of us.
Thank you. Yes, go ahead. Someone else at the microphone there.
So just an observation, and I thought that this was an important place in the conversation that's occurred to this point. And the observation is that it seems when we talk about sacred space, that's obviously reflecting a value and a worldview from which we see healing to take place. But I think it's also important to recognize that that's also happening in the context of environments that when they say something is holistic, it doesn't include the spiritual and the cultural most of the time. So often, like I've worked for the province and we talk about holistic, right? But when it comes down to holistic is biopsychosocial. But the spiritual and the cultural dimensions of that identity are so much even more, I think, effective in affecting the whole of the person. So I just think it's important to recognize that that's kind of an ongoing, I think, challenge for everyone. I see I'm blessed to be in the presence of other healers and people such as yourself in this community that I know that will be more effective because of how you think and how you practice and how you live. But I don't know, just want to encourage you all to continue, in this, and that it's going to take time, and I think advocacy, ongoing advocacy, of recognizing and externalizing that reality, so that people begin to realize and come to that place where, if we are going to respect people and not treat them like commodities or like a product, then we have to change the way we think about ourselves. Mm-hmm. Thank you.
Thank you. Yes, go ahead.
I'm loving this question because it's something I've been thinking about a lot as well. I deal with workshops with youth and run some retreats. One of the girls I work with, she's Indigenous, and we were trying to create a sacred space, and I absolutely loved it because she said, in my culture, it's a lot about ritual. And so I started thinking about how we have been creating sacred spaces for people in the work we do. And it for us, it's about creating ritual as well. And so when we have the group, we do it each time we meet. And one of them is, so it's about connection and respect for energy. So we hold hands, and we call it the energetic squeeze. And so we all hold hands, and we pass the squeeze around, and then at the end we do an om, and we say namaste. And for me, the namaste, it's all just the word in it. The light in me sees the light in you, or I see you. I see you. If you're going to judge me, if you're going to become, enraged, I see you. I see your humanity with the understanding that you are a spiritual being. So everything you were talking about. So creating that space of just acceptance and the ritual around it and the discussion of what it means. I think that's it. It's about performing those rituals and being non-judgmental. And namaste. Namaste.
Thank you. Would anyone else like to share? Maybe one more?
I'm just thinking maybe we'll go till 1, just to give you guys a chance for lunch before the 1:45
Yeah,
workshop.
so that's another
Don't you
couple
love it when
minutes
the
from now.
panel member
I
tells
think
the moderator?
Elaine, go ahead, Elaine.
Elaine, yes.
I've been contemplating creating a sacred space for my clients when they come to me. And the way that I describe it to them is that it's very similar to an operating room, is that only very specific energy or people could be in that space. Because it is a work of the heart, is that we wouldn't invite our friends to come in and walk around while we're having a heart operation. And so it's to do with trust, is that the sacred space, and I explain that to them, that nobody else can be in the room, or no one else's interests can be in the room except yours. Mm-hmm. This is about you, your experience, your thoughts, your feelings, whatever you want to bring in, it's just about you. So I think for me, it's the sacred space can't be separated from trust. And that's what makes it sacred, because trust is sacred. In the way that Gabor Mate worked today, there were people who opened up very deeply in this sacred space that was created today, and it would never have happened if we hadn't trusted him. So that's what I wanted to add.
Good point too. Thank you. So we're going to go to break. At this time, I'd like to thank the panel members for participating today.